American Occupational Therapy Association states that the practice of occupational therapy means the therapeutic use of occupations, including everyday life activities with individuals, groups, populations, or organizations to support participation, performance, and function in roles and situations in home, school, workplace, community, and other settings. So how does OT relate to primary care? We too like to use a holistic approach to treating patients. Specifically, for many patients, we oftentimes center treatment around energy conservation techniques, medicine management, preventative care, education, and coping skills. Think of a patient that has uncontrolled diabetes that struggles with taking their medicine. This is a frequent and persistent problem for many physicians. OTs can work specifically with these patients on developing strategies to take their medications appropriately. These types of techniques might include creating a daily schedule, color-coding their different medications, and other ways of addressing individual problems that are unique to that specific patient. In another example, perhaps you have a geriatric patient that is a high fall risk due to fatigue and general muscle weakness. In order to address these specific issues, an OT might suggest home modifications, like moving rugs, installing grab bars, putting lights in dark places, and moving objects to where they're easily accessible. We could also educate them on the use of adaptive equipment, like a reacher, walker, long-handled sponge, shower chair, and more. We can also educate the patient on techniques for energy conservation. If this patient has a caregiver, we might even teach the caregiver how to safely and appropriately care for their loved one in order to maintain optimal independence. All of these are just a few examples of ways that OTs are able to benefit your patients and work hand in hand with you as primary care providers. There are a handful of unique populations that could benefit from OT services, more specifically underserved communities. These include low income or low socioeconomic status, individuals with English as their second language, low health literacy, rural communities, veterans, uninsured or underinsured, and the mental health population. A patient, for example, with anxiety or major depressive disorder could benefit from occupational therapy to work on coping skills, including deep breathing exercises or visualization techniques. We could also help them by working with them on sensory regulation, including making a sensory kit to help manage anxiety or stressful situations. The development of routines and rituals, as well as engagement in everyday meaningful activities, are other ways occupational therapy can engage clients struggling with mental health issues to increase their self-esteem and promote healthy coping strategies. All of these things are just a few examples of ways occupational therapy can help improve the delivery of primary care. With you as the primary care physicians, it is your job to decide what other services are necessary for your patients. We want you to know that occupational therapy can always play a role in increasing quality of life and engagement in everyday activities. We want you to remember our profession when thinking about the plan of care for your patients. Thank you so much, and if you have any questions about anything OT, please don't hesitate to contact any of the OT students involved in this presentation.